Do you ever feel a fear of heart attack? Have you ever thought to check whether your heart is healthy or not? Do you feel concerned about the rising cases of heart attacks and sudden deaths? If yes, this is a video for you. I am Dr. Mehta, a consultant physician, diabetologist, and a critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. So yes, cases of heart attack are rising, and we have a dedicated video on this topic. Do check it out. But then, what can be done to know what is the risk of heart attack? The most accurate thing that can be done is an angiography. But then, you need to get hospitalized for it, you need to get the dye injected and whatnot. So, what's the next best option? And something less invasive. Yes, we are talking about a lipid profile. It is a blood test that checks the levels of your cholesterol and various other parameters that defines a risk of future cardiac events and also brain strokes. Now this lipid profile is a list of 8 to 10 various cholesterol parameters that has their own significance. So these are the following parameters that are included in the lipid profile. Number 1, serum cholesterol. Number 2, LDL, that means low density lipoprotein. Number 3, VLDL, that means very low density lipoprotein. Number 4, triglycerides. Number 5, HDL, that means a high density lipoprotein. Number 6, HDL by LDL ratio. Number 7, cholesterol by LDL ratio. Number 8, total cholesterol. Number 9, ApoA, that means apolipoprotein A. And the last number 10, ApoB, that means apolipoprotein B. Let's divide these parameters into good cholesterol and bad cholesterol. So the good cholesterol are ones that carry the lipid molecules from your blood out into the tissues. That means the various organs of your body. And the bad cholesterol are the ones which carry lipid molecules from these tissues into your blood. So a high level of cholesterol in the blood is a high risk to heart attack, is a high risk to clots and blocks in your blood vessels. So then the next question is, what are good cholesterol and what are bad cholesterol? The good cholesterol is only one, that means HDL, that is high density lipoprotein. And the bad cholesterols are all other, that means LDL, VLDL, total cholesterol, apolipoprotein A and B, everything else. So here's the thing, if you have higher or normal levels of high density lipoprotein, that is good cholesterol, you have a lower risk of heart attacks. And if you have higher or increased levels of bad cholesterol, you have a higher chance of getting a future cardiac event in form of heart attack or even brain stroke. But also it is very important to note that every parameter of this lipid profile does not hold a similar significance. That means, for example, if you have your triglyceride levels 100 points above a normal, that still is not a big risk to your heart as compared to a just 25 points above normal level of LDL cholesterol. That becomes a bigger risk for future cardiac events. So that brings us to the most accurate predictors of future cardiac events out of these various parameters that we have seen in the lipid profile, and that is LDL cholesterol and lipoprotein A. So if these levels are high, you need to go for the medications of cholesterol after consulting your doctor. Also, it is very important to note that a low level of HDL, that means the high density lipoprotein, also signifies a risk of future cardiac event. And what to do for that? HDL cannot be controlled with the help of medications. There is no proven medications that can significantly increase the levels of HDL. And for that, you need to make your lifestyle healthy. You need to go for a healthy food and you need to exercise regularly to keep the levels of high density lipoproteins in the normal or higher ranges. So that also signifies the importance of a good lifestyle, a healthy lifestyle that includes a good diet and regular exercise to avoid the risk of future cardiac events and heart attacks, and increasing levels of sudden deaths out of them. So I hope all your doubts and questions about heart attacks and sudden deaths are now clear. Do check the parameters of your lipid profile right away and get an idea of the risk related to your heart health. I am Dr. Jai Mehta, a consultant physician, diabetologist, and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.